Opioid Abuse Among Veterans by Chris, Justin, Michelle, Louis Lynn, Rania, Rachel, and Victoria. Health behavior theory that we use is a trans-theoretical model. The first stage is the pre-contemplation, and here the addict is either uninformed about the risk of opioid abuse or they choose to ignore these risks. The second stage is contemplation. In this stage, the addict begins to recognize that there are significant reasons for them to change their behavior. In the third stage of preparation, the addict is ready for treatment. They've weighed the pros and cons of quitting opioids, and they've decided to quit. The addict has also identified the risk factors of a relapse. In the fourth stage of action, the addict finds alternate pain management therapies such as yoga, animal therapy, physical therapy, and meditation. The addict will join a support group and family counseling. In the fifth stage of maintenance, the addict learns techniques to help them recognize and respond to triggers without relapsing back into opioid misuse.
The health communication theory we chose was Kotler's 4 Ps. For place, these include the VA hospital, the TRICARE military clinics and hospitals. This is where the opioids are prescribed by primary care providers. Price. The benefits are that it could decrease addiction and reliance on opioids. It could also decrease risk to addiction to heroin. The costs are that it could harm patients who can benefit and would not misuse this therapy. Promotion. Opioids are promoted as a quick fix for patients' anxiety. They produce sedation and the pain is less intense. Product. Opioids are powerful pain-reducing medications that are constantly abused among patients. When abused, they can cause serious harm, including addiction, overdose, and death.
McGuire's 5 inputs are source, channel, message, receiver, and destination. Sources we are going to use are doctors, veterans, and people who are struggling with opioid addiction. Doctors have high credibility due to their expertise, and they are also the main source of prescribed opioids. So we need doctors to be on the same page and to be willing to advise their patients and promote other wellness methods rather than prescribing opioids. Veterans and people who are struggling with opioid addiction are strong, credible sources because the target audience can easily relate and will not be ashamed of their addiction. When our target audience sees people like them successfully succeed in fighting back against opioids, they are more likely to participate and be motivated for behavior change.
The first channel we chose is a flyer. This flyer will be posted around the VA hospitals and military offices. On the flyer, it has a fact on prescription drug addiction among veterans, and at the bottom of the flyer, there is our Facebook site and Addiction Center hotline that they can call to receive help.
The second channel that we chose is Facebook. It is one of the top leading social media websites. The military can use it to communicate and stay in touch with family and friends as they are constantly on the move. It's easily accessible with features such as Messenger, Facebook, calling, video messaging, etc. This is our Facebook page. It is open to the public, specifically to the military veterans in the San Diego community. This is used to raise awareness for veterans and their family members. There will be links to certain pages ranging from information on opioid abuse and how to seek for help. Fight back against opioids, saving our heroes. The appeal for our message is to let the audience know that we are thankful for their service, and now it is our turn and duty to serve them. To make sure their health is our priority and also it should be their priority as well. We are approaching our audience with an empowering message to motivate them to continue fighting. The receiver. Receiver variables are their civilian life, if they have PTSD, whether or not they are active duty or a veteran, their rank, the branch of service, and the level of pain and stressors, and the severity of opioid addiction. Our destination are motivate behavior change, increase knowledge of the long-term effects of opioid addiction, to decrease reliance on opioid drugs for pain management, and to decrease the opioid abuse stigma.
We have 2 audience segmentations, active duty and veterans. For active duty, our primary audience are those in the military right now. And our secondary audience is their families and other active military members. For veterans, our primary audience are those retired from the military, and our secondary audience are their families and other retired military members. We are hoping our Facebook group will attract the attention of family members of active duty and veterans. We will have awareness posts targeting the family members. We also want to encourage active duty and veterans to spread awareness of our campaign to their friends who are/were in the military via Facebook and word of mouth.
This is David Smith. He's an active military member and lives in San Diego with his family. He got prescribed codeine for a back injury. He states, "Recovery is possible. Most importantly, I am a brother, son, husband, and friend. I no longer want to be a hopeless junkie." Michael Davis is a veteran. He lives with his wife here in Miramar, San Diego. Davis has an opioid disorder in which he now is addicted to. Davis got prescribed painkillers because of a leg amputation above the knee. He had a decent life while on opiate pain meds, and now that they cut them in half, he is in constant pain.
Evaluation. We have a process, impact, outcomes. For the process, decrease the use of opioid among veterans. Impact. By January 1st, 2017, provide an opioid drug program at Veterans Affairs Hospital that focused on helping veterans recover from opioid addiction. For the outcomes, improve control of opioid misuse among veterans by June 1st, 2017, by educating them on the effects on opioid misuse. For the SMART goals, we have specific, measurable, achievable, realistic, and timely. For the specific, by January 1st, 2017, increase the number of trained physicians at the Veterans Affairs Hospital on the use and misuse of opioid from 5 to 10. For the measurable, to decrease the use of opioid consumptions among veterans by 20% by June 2017. For the achievable, target veterans who have just returned from service and offer them a rehab if needed, which will reduce the opioid use by 20% achievable. For the realistic, provide a rehab center in each county to decrease the use of opioid by 20%. For the timely, to have the resource to help 85 to 95 of the incoming veterans by 2019.
That's all, folks.